Cast is now starting. All attendees are in listen-only mode.
Hello, my name is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders. I will be your organizer for this evening and would like to welcome you to our webinar on Introduction to Mindfulness for Stress Reduction. Thank you all for joining us. Before I have my colleague introduce the speaker for tonight, I'm going to cover some housekeeping items with you. All participants are muted. If you have a question, please type it in the bottom of your question box and click Send. You may send questions during the webinar. However, we will have Dr. Shcherbakov answer the questions at the end of his presentation. We will get to as many queries as time allows. And in addition, tonight's presenter is available to take your questions on the Wednesday webinar blog, which is accessed from our homepage under the heading Programs. This blog will be monitored for the next 7 days. Feel free to look and post questions as often as you like. Answers will be archived for future reference. If you missed part of the presentation or would like to watch it again, an archived version will be posted to our website. We value your input, and in order to expand the webinar experience in the future, we need everyone attending to fill out the survey when you exit the webinar. The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introduction of our speaker to Martha Butterfield, the webinar coordinator of NJCTS. Marty?
Thanks, Kelly. Good evening, everyone. Happy New Year. Welcome to our first webinar of several upcoming events that I'd like to bring to your attention. Scholarship applications are now being, and registration is June 5th through the 7th. Details and registration information on all of the above items can be found on our website. Now to the introduction of tonight's presenter, Dr. Anton, in the evidence-based educational outcomes for students with autism. Dr. Shcherbakov has presented at local and national conferences on topics that include reducing maladaptive behaviors in autism, treating body-focused repetitive behaviors, and evaluating provider attitudes towards evidence-based treatment. He also has a special interest in mindfulness as it relates to stress reduction and has presented workshops on the technique and its benefit. To that end, we're changing our usual webinar format tonight. When Dr. Shcherbakov completes his PowerPoint presentation, he will lead the attendees in a mindfulness exercise. Our usual Q&A will follow the exercise. I hope everyone will remain online to experience this directed mindfulness event. Now, without further introduction, I'm pleased to turn tonight's program over to Dr. Shcherbakov.
All right. Hello, everybody, and good evening. Thank you for joining us tonight, and thank you, Marty, for that introduction. I'm very excited to be here talking to you all about mindfulness. This is a topic that's very near and dear to me. I've been practicing meditation for about 9 or 10 years now. It's something that I got introduced to during my time in graduate school, and I found to be so tremendously beneficial in both my personal life as well as in my professional work with clients and with parents and teachers and kind of everyone in between. So I'm really excited to introduce you all to this. I hope that this will be something that following today's webinar, you can kind of start to integrate into your lives and spread the good word. So let me move on here to talk about what we'll cover today. So the first thing that we'll start with is just talking about what mindfulness is. A lot of people may have heard of it before, but I think there's a lot of misconceptions out there about exactly what mindfulness meditation is and what it looks like. Then we'll talk about why it works. I think it's important to understand what some of the mechanisms are that make it such an effective treatment for a variety of things. I know when I was first introduced to it, I was kind of skeptical. It seemed like it was almost too good to be true that this one method or this one technique could work for so many different things. But hopefully, as you start to understand what is going on when we meditate, you start to understand why it can be beneficial for so many different conditions. We'll also talk about formal meditation strategies. So the things that most people probably think of when they imagine meditation and all the different ways and shapes that that can take. Then we'll also talk about adaptations for kids, particularly when working with young children. We'll want to adapt some of the traditional strategies so that they're more interesting and more engaging, particularly for young children. Then we'll talk about informal meditation strategies, which are some of my favorites, and you might be surprised to hear what meditation can actually look like and sound like. Then I'll share some specific ideas for integrating mindfulness into the home as well as the classroom. I know that we have quite a number of teachers and parents who are listening today, so hopefully you all can find something that you can take away from today's presentation. And we'll also talk about the benefits of regular practice. There's been a tremendous amount of research that's been done on mindfulness meditation, and I wanted to share with you all some of what the research and science of meditation is telling us. And finally, I'll share some additional resources, so ways to continue the practice at home, including apps and websites and books that you can use. And actually, finally, after that, for those of you that are able, we will do a mindfulness of seeing exercise, something that hopefully you can participate in and then, bring to use in your everyday life, whether it's for yourself, for your children, for your students, with a spouse, etc. So that's kind of it in terms of our outline. And let's begin with just talking about what mindfulness is. The best definition that I've ever found is one from a book called Wherever You Go, There You Are, which is written by Dr. Jon KabatZinn, who we'll talk about shortly. And the way that he defines mindfulness is relatively simple. It is just paying attention on purpose in the present moment and non-judgmentally, right? So let's just break that down into those component pieces and just understand what exactly is being said here. So the goal of mindfulness is meditation, and just as a point of clarification, I'll use mindfulness and mindfulness meditation interchangeably. When I'm talking about mindfulness, I'm really talking about the practice of meditation. And so mindfulness meditation is about paying attention. And I focus on this for a second because this makes it different than other forms of meditation that are out there. Not all types of meditation are mindfulness meditation. Some involve trying to attend, different or get to different states of consciousness, like transcendental meditation. Whereas in mindfulness, the goal is just to pay attention, to be present with whatever is. It's not to eliminate your thoughts or to find a quiet place in your mind where there is no thinking. It's actually just to pay attention. And in mindfulness, the way we pay attention is on purpose. We choose to direct our attention to something in particular. And the thing we pay attention to is in the here and now. It is not about thinking about the past. It is not about thinking about the future. It's really about thinking about what's in front of us. So that is kind of a distinct feature of mindfulness. And lastly, we try to do so non-judgmentally, that we notice our brain's tendency to judge, and we do our best to back away from some of that judgment, perhaps to observe it, but to observe our experience as best we can without judging it. So that's kind of it in a nutshell. And I think it's important to take a step back here and just talk a little bit about some of the history of mindfulness, because this is a question that comes up a lot when I do this presentation in person. People oftentimes associate mindfulness meditation with Buddhism, and there's a good reason for that. we know that mindfulness meditation originated at least 2,500 years ago in India and China. And we do know that it was practiced by Buddhists, and it was called Sati originally in the ancient Pali language that's native to India. And indeed, meditation was seen as one of the 7 factors of enlightenment in Buddhism. So it sort of originates as a spiritual or even a religious practice. But the way that we're talking about it here today, the way that it's been incorporated into modern psychological research, is not a religious practice. I'm not asking anybody here to convert to any particular religion or adopt any particular religious beliefs, because the way that we've studied it in psychology is as a secular practice, that's a non-religious practice that is beneficial to both mental and to physical health. So for any of you all that might have been kind of concerned about that, I think, meditation or mindfulness meditation specifically is totally compatible with any religious beliefs you may have, in spite of perhaps its origins in a more religious or in a more spiritual sense. And so mindfulness is actually relatively new to the West, meaning America and Europe, even though it is a very ancient tradition. And the man most frequently credited, excuse me, for introducing mindfulness to the West is this man right here, Dr. Jon KabatZinn. He founded the Mindfulness Stress Reduction Program, on which this training is based, this webinar is based, back in 1979 at the University of Massachusetts. And the reason that he had started this program is because he was working with a lot of people that had chronic health conditions, things like chronic pain or diabetes or fibromyalgia, cancer and things like that. And he was finding that a lot of these folks were really suffering from the stress, from the pain, from all the associated things that come with having a chronic health condition. And he was really able to demonstrate some pretty amazing findings that we'll talk about a little bit later in the webinar in terms of what he was able to achieve with these folks in implementing this mindfulness program. And since that time, mindfulness has really taken off in terms of its the research interest in psychology. And since that time, mindfulness has been incorporated into a number of therapies, some of which include mindfulness-based cognitive therapy, or MBCT, which is a treatment for preventing the relapse of depression. And actually, in recent years, it's been adapted for helping to prevent suicide amongst high-risk veterans. I was actually part of a randomized controlled trial that was going on at the VA a few years ago now, and we were able to demonstrate that with just a relatively brief 8-week program, we were able to increase the likelihood that our program participants, our veterans, would not either make a suicide attempt or actually even follow through on committing suicide. So it was a pretty amazing finding, and one that we were very proud of and very excited about, since it is such, it's really an epidemic. So it just kind of goes to show the power of a relatively brief intervention for, making a life-changing effect. So that's MBCT, or mindfulness-based cognitive therapy. There's also ACT, or acceptance and commitment therapy, which has been shown to be effective for reducing symptoms of depression and anxiety, as well as some other conditions. And mindfulness meditation is a big component of that treatment. And the last one that I mentioned here is just dialectical and behavior therapy, or DBT, which has been shown to be a very effective treatment for what's called borderline personality disorder. And so as all this research is being done on the benefits of mindfulness in psychology, a lot of other industries started to take notice. And since that time, mindfulness has been incorporated and researched in places as diverse as schools and businesses, law enforcement, prisons, and the military. It seems like everyone has kind of taken notice and started to explore if there's any potential benefits to integrating mindfulness meditation into their setting. Now, at this point, once I started learning about all this in graduate school, like I said before, I was kind of skeptical. I was wondering how, such a relatively simple thing could have so many far-flung benefits. And so I started getting interested in how mindfulness meditation might work and why it's seeing such broad kind of interest and research attention. And so, here we go. So why mindfulness? Well, there was this really interesting study that came out and found that the average American spends about 47% of their waking time thinking about things other than what they're doing. Just let that sink in for a second, that almost half of the time that we're awake, we are not focused on the present. We're not focused and paying attention to what's in front of us. It's kind of shocking. And if you reflect on your own experience, you can probably recognize that that's probably true for you. Maybe you spend much more than 50% of your waking time. Maybe you spend a little bit less. But for many of us, we spend a lot of time traveling in our minds. So, well, so what? Like, why is that? Why might that be bad? Why might that be a problem? Well, research has shown that mind wandering leads to us being less happy. And that's true if we're thinking about unpleasant things, obviously, right? If we're thinking about the past and we're getting stuck on someone that's wronged us or something that went wrong, a mistake that we made, that's obvious that that would make us feel unhappy. But even if we're thinking about neutral topics, mind wandering tends to lead to reduced happiness as well. And in my mind, that's kind of an even more interesting or compelling finding, that even if we're just daydreaming about, I don't know, what we're going to buy at the grocery store, or what streets are we going to take home to, what streets are we going to take from work to get home, we still see reduced levels of happiness in folks. So why might that be the case? Well, the biggest factor is when we're time traveling in our minds, we're not engaging with what's in front of us, right? If you're sitting there and you're eating your lunch and you're thinking about, what am I going to cook for dinner today? These are the ingredients I have and this is the ingredients I don't have, right? You're not enjoying that lunch that's in front of you. You're not enjoying the food. You're not tasting it. You're not really experiencing it, right? So we're not engaging with what's in front of us. And the other two things that I put up here, one is rumination and the other is worrying, is actually what we tend to do most often when we mind wander or time travel in our minds. So rumination is just a fancy way of saying thinking about the same thing over and over and over again. And studies have shown that rumination is a really strong predictor of depression. People that have a tendency to ruminate, to go back over the past and think about the same things over and over again, to dwell, tend to experience higher rates of depression. And it seems to be that many of us, when we think about the past, we tend to ruminate, we tend to get stuck, we tend to think about the same thing over and over again. Right? And it's usually unproductive because we obviously can't change the past. So that's why rumination can be a problem, or thinking about the past. The other issue is that when we think about the future, we tend to worry. Most of us, when we think about the future, we don't tend to think about pleasant things like, I can't wait for my vacation, or, I can't wait to be retired and hanging out on a beach somewhere. Or, I can't wait to see how XYZ turns out. No, instead, we tend to kind of anticipate the worst, like what's going to happen if I get fired, or what's going to happen if my boss doesn't like what I did on this job, or what's going to happen if XYZ happens to my kid, right? We tend to worry rather than to think about pleasant thoughts. So that's part of why there's this intense focus on increasing our present focus or our present awareness in mindfulness meditation, to pull us away from some of that rumination, to pull us away from that worrying, and to help us engage more in what's going on in front of us. And I really love this cartoon here that I share. You know, it really kind of sums up exactly what I'm saying here, that when we focus on the past, some of the things we tend to experience are guilt, regret, grievance, sadness, bitterness, non-forgiveness, right? And when we focus on the future, we tend to feel unease, anxiety, tension, stress, worry, and fear. And so probably the only place that we can really find peace is in the here and now, in the present. You know, this little character that's in the middle here, who's sitting with the flowers and the rocks and has those little hearts over his or her head, you know, that's the one place where we can really hope to find peace. And yet the place that we tend to spend relatively little of our day-to-day time. And, you know, this is not to say that we should not think about the future and we should not think about the past. Of course we have to do those things. If you don't think about the future, you don't plan for retirement. You don't make contingency plans for when things go wrong. If you don't think about the past, you can't grow from your experience. You know, those who don't study history are doomed to repeat it. But the general finding is that we all probably spend a little too much time thinking about the past and the future, and probably not enough time actually just being present, and to use an old cliche, just smelling the roses, right? Instead, we tend to get sucked into time traveling in our minds. So some other thoughts on mind wandering or mindlessness and why it can be problematic. You may not realize this, but in fact, we spend most of our lives on autopilot. I'm sure most people listening to here can relate to the experience of getting in their car, arriving at their destination, and then thinking to themselves, how in the world did I get here? Like, what highway did I take? Like, what turns did I make? Who was driving the car? Because it wasn't me. You know, when we're stuck in autopilot, that happens a lot. Or another example that frequently happens to me, I'll look down into my bag of chips that I was just eating and say, what happened? Who came in here and stole my chips? Right? It's like I just had opened this bag and all of a sudden it's empty. Well, the truth is I was on autopilot. Maybe I was watching television, maybe I was talking or thinking about something. And I let that moment of joy, that moment of, you know, just the sheer pleasure of eating some tasty Pringles slip away from me. And so one of the goals in mindfulness or in meditation is to help turn off that autopilot so that we can re-engage in our lives, right? To go from that automatic mode to that more deliberate and attentive mode that is what mindfulness is all about. And one benefit of that I alluded to is allowing us to tune into the pleasures of everyday life, right? That eating those Pringles, or as you're walking perhaps between your car and your front door, noticing the birds that are in the trees, noticing, you know, the smell of a crisp winter day, you know, noticing what snow-covered trees look like, right? These things can give us great pleasure if we we take a moment to actually pay attention as opposed to just ignoring them. But the other benefit, and one of the reasons why I think mindfulness can be so helpful to children and to many adults, is it can improve our ability to respond rather than reacting, right? Because when we're on autopilot, we can react very emotionally to situations that come up, right? So if I'm just in reaction mode, if I'm on autopilot, if my wife comes up to me and says, hey, you know, how come you didn't take the trash out last night? Like you said you would, like, what's the deal? My reaction, my autopilot response might be to get defensive and say, oh, well, I got home so late and like, what's the big deal? X, Y, Z, blah, blah, right? That's probably not the way I actually want to respond to that situation. But if I can take that autopilot off and hear what she's saying, I can probably respond in a more effective way, like, hey, I'm sorry about that. Let me take care of it now, right? That would be the response that in my heart of hearts I would actually want to give in that moment. And so practicing mindfulness meditation can help us to be more effective at turning off that autopilot, to notice when it's on, and to practice being present in that everyday life and noticing some of those pleasures. And so that's kind of why mindfulness works. It is about tuning into the present, responding rather than reacting, and about, not letting ourselves get sucked away into the future or into the past and some of those negative thought patterns. Well, how do we do that? So there are two broad types of strategies that I'll talk about with you all today. The first that I'm listing here are going to be the formal meditation strategies. So a lot of these will be what you might think of when you think of meditation. And there might be some on here that are not what you would expect meditation to look like. Also, we'll talk about informal meditation strategies, as well as ways of meditating with kids, and how to integrate meditation in the classroom. And those informal strategies tend to be briefer and maybe things that you already do from time to time and just don't even realize that those are actually mindful or meditative things to do. So let's start first with the formal strategies. So one of the most common and I think most frequently introduced as one of the earliest meditations that people do is something called the body scan. And actually, let me back up a little bit and just talk about what formal meditation generally kind of looks like. So usually when you're doing a formal meditation strategy, you are setting the intention to meditate. You're trying to find a relatively calm or quiet place where you can do that. And, it can range in any length of time that you want. It could be as short as, 2 or 3 minutes, and it can be as long as an hour, or much longer. Actually, as I was getting my mindfulness training, our final day of mindfulness training was to do a full day of meditation. It was 8 hours in total silence. And, people go on even longer retreats, 7 days or 14 days. That's probably a little more than I want to do. I think, 8 hours was plenty for me to experience there. But so just to say that formal meditation strategies are very flexible and you kind of adapt it to your needs and to your abilities. So the body scan is basically, you can do this while sitting, you can do it while laying down, you can do it while standing. And the general direction is to close your eyes or let your gaze kind of rest on a spot somewhere in front of you, and to follow directions, if it's a guided meditation, to pay attention to each part of your body in sequence, paying attention to your toes, to your ankles, your knees, your abdomen, your chest, your shoulders, and so on, and just noticing anything that's present there. Is there pain? Is there tension? Is there warmth? Is there coolness? And so on and so forth. This tends to be pretty relaxing. A lot of people like doing these prior to going to bed or first thing in the morning to kind of get started for the day. Those are great times to do a body scan. There's also something called the 3-minute breathing space. So as the name implies, this is just a 3-minute meditation. And it's actually a really great thing to do if you're feeling tense or anxious throughout the day. It's one of my favorites to kind of pull out in therapy to teach people as a tool. It's also something that I'll do if I have a particularly challenging session where I'm feeling, stressed or anxious or whatever. Doing a 3-minute breathing space before I see my next client can be a really nice and helpful thing to do. And basically a 3-minute breathing space just walks you through a 3-step kind of process. The first is becoming aware of things that are around you. The second is focusing your attention on your breath. And the third step is just expanding that awareness to include a sense of your body in addition to your breath. And it does tend to be pretty relaxing as well. Sitting meditation is the one people most frequently kind of associate with meditation or with mindfulness, which would be sitting down. You don't have to sit with your legs crossed. You can sit in a chair, you can sit on a couch, it doesn't really matter. And you might focus on your breathing, you might focus on your thoughts, you might focus on bodily sensations. You know, any one of those three, or possibly even, you know, sounds around you are kind of fair game for a sitting meditation. And again, this can range from just a few minutes to an hour, 8 hours, really as long as you want. Loving kindness meditation is one of my favorite meditations, actually, and the one that a lot of the excuse me, veterans that I worked with tended to struggle with. The loving kindness meditation is about directing your attention to thinking, you know, compassionate and positive thoughts towards yourself, towards others in your life. It is really just trying to embody that feeling of loving kindness. And for a lot of my veterans who struggled with self-compassion, this was a really challenging meditation to just sit with some positive feelings. But it can be a really powerful experience to be in that place, to spend, you know, a few minutes being compassionate, whether it's towards yourself or towards others. It's a really wonderful experience, and I highly recommend it. Walking meditation can be a formal meditation. So that might be walking and focusing on the experience of taking steps and noticing the feeling of your foot, your shoe, you know, that whole thing. Or it can be walking and focusing on nature around you, or on the sounds around you, or anything like that. Those can all be formal meditations. And last but not least, mindful movement, of which one form is yoga, is also a formal meditation strategy. I'm willing to bet that many of you all listening tonight have had some experience with yoga and have sort of noticed how it can really suck you into that present moment, you know, really focusing on your stretches, on the different yoga positions, and feeling your body in that moment. It really pulls you into the present, and it can be, you know, wonderfully relaxing and enjoyable to do that. So that is also, you know, a type of meditation, and we call it kind of mindful movement more broadly. So that's it for the formal meditation strategies. And I just wanted to talk about some potential adaptations for children, for those of you that want to try this either with your kids or with your students. So the first thing to note is there's really no lower age limit that I'm aware of or that I've experienced for mindfulness meditation. But realistically, you probably wouldn't do it with any kids that are younger than 4. But you can do it with kids as young as 4. So that's kind of a good thing to keep in mind. But when we're working with especially younger kids, shorter and more interactive is better. You are not going to get a 7 or 8-year-old kid to sit for an hour and listen to a guided meditation about breathing. It's just not going to happen. Good luck even doing that with a 12 or a 14-year-old, or an adult with that, for that matter. So shorter is better, more interactive is better. And I'll share some examples of what I mean with interactive. So one example would be what I'm calling here a slow-mo snack, or a slow motion eating. So taking the time to really mindfully eat something that's tasty to the child. So taking like a Pringle, for example, and rather than chomping it all down in 2 bites, taking a little bitty bite and noticing what it tastes like, what it feels like, describing it, and just really doing it very slowly and mindfully. Blowing bubbles can be incredibly mindful. You know, paying attention to a bubble slowly expanding as you blow into it before it leaves the little wand that you're blowing the bubble from. Noticing 1 or 2 bubbles just flying around and seeing the path that they take. A very mindful activity that a lot of kids really enjoy. Doing a mindful nature walk. So as opposed to walking and kind of talking about any possible thing, really trying to pay attention to what's around you. Like, you know, let's name all the things that start with the letter are that we can see, or let's name all the things that are green or yellow or something like that. Let's listen to the crunching of the leaves as we're walking. You know, trying to really focus on the experience of just walking and being wherever it is that you are. Finding shapes in clouds. This is something that most of us have probably done at some point in our lives. Looking up at the sky and trying to imagine what any given cloud can be. That's such a present, focused activity, and you know, oftentimes just a great deal of fun to do with your kids and seeing what kind of things they come up with. Breathing with images. So as kind of a variation on the focus on breath that we do with adults, with a kid, you might have them imagining a pizza. And as they breathe in, they're smelling the tasty pizza and their mouth is watering. And as they breathe out, they're blowing on the pizza to cool it down because it's too hot for them to eat. Same thing with a cake, right? Smelling the cake and then blowing out the candles, blowing out and blowing up a big balloon. Those are all fun activities to do with kids that can help them to kind of stay focused in the present and really engage with mindfulness. With adolescents, as they get older, they might be a little bit less interested in some of those activities that I shared, and they may actually enjoy structured and more lengthy meditations. So, you know, especially if you introduce them with some of the shorter meditations and it's something that they enjoy, you can actually work up to doing much longer meditations with them. You know, I've done meditations as long as 10, 15, 20 minutes with adolescents. Usually not much longer than that, but certainly not impossible. But it can be hard with the, you know, tightly packed schedules that we have these days. So those are some adaptations for children. I also just broadly wanted to talk about informal mindfulness strategies that we can all use, adults and children included. One of my favorite informal mindfulness strategies, and something that I try to do on a daily basis, is do some routine activity while turning my full attention to just that activity. So the one that I do every single day is paying attention to brushing my teeth. So when I'm brushing my teeth, rather than thinking about what I need to do or what I haven't done, my to-do list for the day, I try to just focus on the feeling of the brush in my mouth, of noticing, you know, the bristles, noticing the little foamy kind of soapiness that comes from toothpaste, really paying attention to brushing each individual tooth, and so on and so forth. I find this to be tremendously relaxing and enjoyable, and a lot more enjoyable than kind of worrying about what is going to happen that day, or at the end of the day thinking about all the things that I didn't get done, right? So it can be something like that. Also, another informal mindfulness strategy is just taking a moment to take 5 slow, mindful breaths. Just noticing yourself breathing, really paying attention to it. There's a lot of apps out there that can kind of ding you or give you a notification to take 5 mindful breaths. If you're a teacher, you can, you know, ring a bell in the classroom and just remind everyone to take a few breaths. This can be a really nice way to recenter and get focused for a few minutes. Full attention, eating or drinking. So I don't know what it is about this suggestion, but when I do this presentation in person, this one seems to generate the most controversy. And really what I mean by this is, you know, for at least one meal or an occasional meal during your week, just focus on eating or drinking and not doing anything else, right? For most of us, when we eat lunch or we eat dinner or we eat breakfast, it's oftentimes on the go, or we're multitasking, right? We're eating lunch and we're answering emails. We're eating dinner and we're, you know, doing the laundry, or watching TV, or on our phone, or reading a book, or managing some fire with our children. Every once in a while, just taking the time to just eat, just to sit there and eat whatever it is, whether it's a sandwich, a bag of chips, you know, a bowl of cereal, just bringing your full attention to that experience of eating. It can just be so delightful and relaxing as well. Waiting in line. Now, I don't know about you all, but this is one of my least favorite activities of all time. I hate waiting in line. But I found that rather than focusing on how much I hate waiting in line and what is taking these people in front of me so long, focusing on the environment is such a better way to spend that time. You know, noticing who else is standing in line, what sort of things are they buying? You know, what does the store look like? What does the store sound like? How's my body feeling right now? Just really kind of getting out of your head and just being present can be a really powerful experience. Noticing tightness in your body throughout your day. I know for me, I tend to carry the most tension in my shoulders. I don't know what happens, but they start off at where your shoulders should be. And as I get more and more stressed, they end up getting closer and closer to my ears. And so every once in a while, I try to catch myself and say, hey, what are my shoulders doing all the way up here? Let me release some of that tension and bring them down, right? Just doing a check-in with yourself like that throughout the day can be a really nice thing to do to enhance, you know, being in the present moment. Taking 3 minutes in your car. So this was something actually suggested by Marty and Kelly. I forget which one of them. But taking 3 minutes perhaps before coming home, you know, walking into your house or before walking into your work, just take 3 minutes and just pay attention to yourself, to your body, to your surroundings. You know, take a few deep breaths and just allow yourself to be present before you walk into the chaos of whatever awaits you at work or at home. I think that's such a wonderful idea. Walking, we walk all the time, right? Whether it's walking inside of our homes, walking in our offices, walking outside, right? Just paying attention to that action of walking, wherever it is that we're doing that. And the last one that I share here as an idea, and it goes with my little picture here, is opening a door. It's something that we do all the time. It's just another mundane routine activity, but it can be a great reminder to get present, to get centered for a moment. You know, as you open the door, just notice what the door feels like. You know, notice the feeling of the knob in your hand, the weight of the door as you push it. Notice the little creaking sound that it makes if it hasn't been oiled recently. Just really take in that experience. Notice the change that happens when you go from outside to inside. Particularly in the winter, I love that feeling of coming in from the cold outdoors and entering the warmth of a house. Oh, it's so delightful, right? Just taking that moment to recognize that change. It's so, so nice. So that's kind of it for the informal mindfulness strategies there, although a lot of what I'll talk about here in this next slide are kind of extensions or at times kind of repetitions of some of those strategies. So as I know from some of the surveys we did beforehand, a lot of you all listening today are school teachers, perhaps some nurses or other professionals working in schools. A lot of you are also parents. So I wanted to provide some recommendations for ways to integrate mindfulness into your homes and into your schools. So just have some ideas here. It's by no means an exhaustive list, but hopefully we'll, you know, jog some of those ideas and you can expand on them from here on out. Starting or ending class or, you know, returning home with a mindful moment. You know, everyone kind of settling into their desks, and let's just take a moment to breathe, to pay attention. Or prior to the end of class, let's take a moment before we transition to just be present. Playing a guided meditation recording. So I'll share some links for that shortly. So recordings that you can use with your kids to actually do some of those formal meditation strategies. Mindful snacking, as we've talked about. Taking a moment to take a stretching break, right? Just encouraging your kids to get up and just to stretch. And that can be in a directed way, like, you know, I want you all to do this stretch and then that stretch, or just, you know, free form. This is a form of mindful movement. Creating a sensory jar. Those of you who are teachers might be familiar with this, or maybe some parents as well. I have an image of a lava lamp here, which I don't even know if they make them anymore. I haven't seen one in a long time. But that's kind of what a sensory jar is like. You basically put water, food coloring, glycerin, glitter, marbles, maybe not marbles, but beads, and all sorts of little things in a jar. And then what's really cool is you can kind of shake them up. And as things start to settle, you see all sorts of motion and patterns that you can observe. And kids really enjoy this. And again, it's something to kind of bring them into the moment and just be present, to be centered. Doing a guided imagery exercise. So imagining, walking kids through, imagining themselves on a beach and listening to the sound of the waves, and is there any wildlife sounds, imagining a crab walking along and that sort of thing. And you can find scripts for that online. Just really type in, guided imagery for kids into Google and you'll find a whole lot of stuff. Taking a minute of gratitude. I love doing that. If it's at home, asking your kids, what's one thing that you're grateful for? It's something that we tend to do during Thanksgiving time, but not something that we tend to extend throughout our, the rest of the year. And I think it's such a great way to be present for a moment, and has actually, being grateful is one of the things that's really been shown to enhance happiness in adults and kids. So it's a really great exercise to do. And lastly, mindful listening to music, listening to nature sounds, listening just to whatever is around us, just really paying attention for a few minutes can be a really great mindful activity. And so I kind of end all this with this nice little cartoon about the difference between having a full mind, being mindful, or being mindful. Right? The man, I think it's a man on the left there, the person has his mind full of all sorts of things, bills and people and cars and maybe a speech he has to give. And then there's this dog that's just seeing the trees and the sun. And what a difference that must be in their emotional experience, right? I know who I'd want to be in this scenario. I'd want to be the dog. That looks much nicer. So I'm going to just quickly go through some benefits of mindfulness for adults. You all can look at this later if you're curious. But so reduce distress and pain for chronic pain patients is one of the earliest findings that came out of Jon KabatZinn's research in terms of mindfulness-based stress reduction. Decrease in hypertension for cardiovascular patients. So hypertension, for those that don't know, is high blood pressure. So a pretty remarkable finding, and just reminds us of the connection between our mental and emotional health and our physical health. Reduce stress, anxiety, anger, and depression for individuals with a variety of physical health conditions like fibromyalgia, cancer, diabetes, chronic pain. And also reductions in symptoms associated with a variety of mental health conditions like depression and anxiety and so on. So some really cool findings. But besides just reducing some of those negative things, also improving positive affect or positive emotions, increasing a sense of spirituality, self-compassion, overall quality of life. So pretty cool findings. And also increasing the likelihood of successful treatment for alcohol and substance use problems. Then I'll go through this pretty quickly as well. A lot of these benefits have been replicated in children and adolescents. Also in children and adolescents, we see some improvements in attention, impulsivity, and executive functioning. So for those of you who work with or have children with ADHD, there's some research coming out that's really starting to show that there's real benefits there of engaging in mindfulness practice for them. Improved blood pressure, like in adults. Reduction in social and behavioral problems. So kids who go to schools where mindfulness programs have been implemented seem to exhibit less problem behaviors like tardiness, skipping classes, bullying, just general kind of conflicts or fights between peers. That's all been kind of demonstrated in the research literature that we have. And generally, kids tend to enjoy mindfulness activities. I think when they're done well and catered to their age group, most children that I've worked with enjoy the mindfulness activities that we do. And there does seem to be some evidence that it's somewhat more effective for adolescents than younger children. And that might be just because in general, the rates of mental health conditions also increase in adolescents, but also because they can engage more fully with some of the more formal meditation strategies. And they have more of that abstract kind of thinking that can really respond, that can really understand what the goal and the purpose of mindfulness is. And then lastly, I just want to say a little bit about effectiveness for tics. So a 2015 study showed that after an 8-week treatment of mindfulness-based stress reduction for tics, 59% of participants reported an improvement in their tics, and that was about a 20% decrease in tic severity. So not a huge change, but something that's noteworthy. And it's really just the first study of its type. So we really need some more replications here to really be confident in these results. And also worth noting is that it was done with individuals who were 16 years or older. They didn't use kids in their study. But something to be aware of for those of you that have children or work with children who have tics. And the improvement from the study was maintained at a 1-month follow-up, which was good to see. But again, we'd like to see a longer replication there ultimately. And they used a special recording that was geared towards people with tics, kind of increasing awareness of that premonitory urge, as well as increasing that ability to just notice it without responding to it. So, you know, I'll actually share a link to that recording that was used in the study for those of you that are interested. You can try using it with your kids or perhaps with yourself. So here's just a list of resources. We have some apps like Headspace and Calm, which have free trials, but do cost some money if you want to subscribe to them, but they're great and I think well worth it. There is an educator discount for those of you that work in schools. Just type into Google like Headspace app, educator discount, and you'll be able to find that. YouTube's a great resource. Just type in, you know, meditation for kids or meditation, you know, body scan, any of the formal meditation strategies that I shared, and you'll find a wealth of stuff there. Some books like the one that I mentioned by Dr. Jon KabatZinn, as well as a self-help book called Mindfulness, an 8-Week Plan for Finding Peace by Mark Williams and Danny Penman. That's based on that mindfulness-based cognitive therapy protocol, and it's just a great introduction to mindfulness and its benefits for mental health. And lastly, just 4 links to online recordings of mindfulness meditations, including that tic-focused meditation, as well as 3 research centers that have shared their meditation recordings that they use in their research studies for free with everyone. So just to be aware of all of that. All right, so I'm aware of the time, and I know we'll be cutting into our Q&A time a little bit, but I just wanted to do a brief mindfulness meditation with you all for those of you that are able to participate. Just be, you know, 1 or 2 minutes, a brief mindfulness of seeing exercise, just to give you a taste of what it looks like and sounds like. So if you're able, trying to find a relatively calmer or quieter space, you know, sitting down if you're able, and to look at the screen, and I'll just walk you through what this looks like. So without further ado, let me get it started. So I would like you all to just begin by paying attention to this image that's in front of you, of the colors that are present, perhaps noticing, perhaps movement, noticing, seeing, you know, some difficult it is, how much a challenge, you know, having these moments of painful kind of thoughts, images, and memories. And so, you know, we want to sort of prep our student, our kid here, that might happen, and just talk about what they, you know, what they can do if that happens. You know, for an older kid, I might just encourage them to move their focus back to whatever it is you're trying to focus on, whether it's, you know, breathing or looking at a picture or whatever it might be. For a younger kid, I might encourage them to like raise their hand so that we could kind of do something else to get their mind off of it so they don't get sucked too deep into whatever it is that's bothering them. So that's just a consideration when working with anyone with trauma. In terms of engaging them, I would say using some of those recommendations that I had on that slide for home and school, just trying to do something that's fun, that's enjoyable. One of the first mindfulness activities that I often do with people is that slow-mo snacking or that mindful eating. You can find directions for doing
the individual ahead of time. So that, okay. So this,
Right.
all right. The question about this individual as a negative, and individuals ruminate over positive things, or is it all?
Yeah, so rumination, the way that it's been defined by psychologists, would be a negative thing. It's thinking about the same thing over and over, negatively, something negative, and thinking about that over and over in a way that's really not productive. You know, so thinking about, you know, something rude that someone said to you. If you're reflecting on, you know, wow, I had such a great day yesterday and I just want to bask in that, that's wonderful. Go ahead and do that. That's not rumination. And we're not really concerned about that. But sadly, most of us don't use our mental time traveling ability to do that.
Or some family dispute that you're upset about and you can't let go of.
Exactly right.
Then those situations, I mean, in that particular situation, wouldn't it be better to just, if you could, confront that issue with the individual that you're having whatever the issue is?
Right. So, you know, in my work as a psychologist, I try to help people distinguish between, you know, reflection and rumination, and also between problem solving and rumination and worrying. So problem solving is when we're thinking about the past or the future and we're working towards some kind of a solution, right? I'm really unhappy with how, you know, what my wife said to me yesterday. So I think this is what I should say to her, and I think I'm going to go and do that, right? That is wonderful, right? We want to do that. We want people to reflect on things that make them unhappy and to take some concrete actions to resolve those problems. But just thinking about,
and then you keep playing as the correct one then, of course.
Right.
Okay. Can you elaborate a little more on the PTSD treatment? And second part of this question is, where would someone go to get help in that area?
That's a great question. So for PTSD, this treatment was part of a research study that we were conducting at the VA. It is based on the mindfulness, probably relatively minor modifications to it for PTSD and for suicidality. And that was just kind of helping people to understand their PTSD as well as creating a safety plan, you know, if their symptoms got really bad, that they knew what to do. In terms of accessing that particular treatment that we studied, unfortunately, you know, there's no providers in the community that I'm aware of that have been trained or experienced in it. If you are a veteran, then you can, you know, talk to the VA, a provider at the VA, and see if they can help you get access to that. But I would say, you know, the best way to get a version of that treatment would be to find a provider that is experienced in mindfulness-based cognitive therapy, because like I said, it's very, very similar.
Okay. Regarding mindfulness for a kid, in this case, the 4-year-old, would you be able to kind of achieve that same thing by reading a book or just enjoying a picture book and just flipping the pages and just talking about the pictures in the book? Would that kind of accomplish what you would want to accomplish for that 4-year-old? I mean, their attention span is short anyway, so the book is, you know, you're talking maybe 5-10 minutes tops.
Yes, absolutely. So, you know, what I hope to get across with some of those informal meditation strategies is that really almost anything that we do as humans can be done mindfully, absolutely be done mindfully. One of the best ways to do that is, engaging the child in the book, asking them questions, having them take a look at the pictures and like examine the scene, really kind of tuning in, right? And just doing the book reading as opposed to, having the TV playing in the background, someone else coming in and out. It's very hard to be mindful when there's lots of different things going on.
But it doesn't necessarily have to be a silent moment then. It could still be drawing their attention to items in the book.
Yeah.
So that they're communicating as well. Okay.
Absolutely, yeah. So, and with kids, oftentimes it won't be silent. I learned this pretty early on in trying to do mindfulness meditation with kids, where I'd say, like, close your eyes and let's do this breathing exercise. And then, as opposed to kind of hearing my rhetorical questions, they would answer all of my rhetorical questions. And that's totally fine. If they're engaging, if they're present, that's really all we want. We want them to be here and now rather than thinking about that past or the future. And, I would say in general, kids tend to be more mindful than we are as adults. I think their tendency is to be more future focused. But for those kids that are, that do have anxiety, that experience behavioral problems, a lot of times or people in focus. And that's really all we're trying to help them to do.
Okay. We've gone over. I'm going to ask one more question and then we'll wrap it up there. Question about this technique, this mindfulness technique, and its use with senior citizens. Has there been any work done in that area? Because the things you're talking about, present, being in the present, and mindfulness, mindful of that, and not worrying about the future and not getting stuck in the past. For a senior citizen, particularly someone potentially in a nursing home, a lot of going back because that's what they have. They have the back. They don't have the future. So how would mindfulness, or would it be effective or useful in that situation?
Oh, absolutely. One of the rotations that I did on my clinical internship was working in the nursing home at the VA. And again, when we're talking about applications towards folks who struggle with depression or with anxiety, there is something that we do, right? So, thinking, raising them, or I feel really bad about this thing that happened, right? Or worrying about the future, what's going to happen when I can no longer walk? What is that going to be like? What's, this further deterioration of my health going to be like? And so, I think your point, and what a lot of people, I think about in these settings is like, well, the present must be so depressing. Like, we want to pull our senior citizens out of that. Like, how could they just be in the here and now when it seems like the here and now is kind of depressing in some way.
That's so good, yeah.
Yeah, but when I have done mindfulness with older folks in that setting, they're able to tune into the things that are still pleasurable in their lives, because there are lots of things. I mean, yeah, they're different, but again, that's that time traveling mind. But taking, I would during my therapy sessions, I would take some of the veterans out on a walk, right? And I'd be pushing them in their wheelchairs, and I'd have them just like, hey, like, look at the trees, listen to them rustling. Let's look at that bird. Wow, it's a kind of a nice day today. It's a warm day for January. There's still pleasure to be found in the everyday life, right? A lot of the veterans that I worked with would get so excited when, something was different. It's like they had like a pizza party one day, to really let yourself like enjoy that rather than focusing on what you don't have anymore. I think there's power in that for anyone, from our, youngest children to our oldest adults.
Okay, well, I am going to wrap it up here. This has been a really fascinating presentation, so thank you very much, Dr.
You're very
Shcherbakov.
welcome.
I appreciate your time, and I am going to turn this back over to Kelly to just wrap things up.
Yeah, and thank you for having me.
You are most welcome.
Thank you for joining our webinar on Introduction to Mindfulness for Stress Reduction. There is an exit survey which we need everyone attending to fill out. The webinar blog is now open and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived version of tonight's webinar will be posted to our site. Our next presentation, Improving Social Outcomes for Children with Tourette Syndrome and Other Neurodevelopmental Disorders, will be presented by Aslan Theobald and is scheduled for February 12, 2020. This ends tonight's webinar. Thank you, Dr. Shcherbakov, for your presentation, and thank you, everyone, for attending. Good night.